in a mobile unit to go out into the community. Now, we've hosted pop-up vaccination clinics around the county over the past few months, but this is our first effort using a mobile unit. So we hope to expand this mobile vaccination program as a way to reach more people in our community who are not yet vaccinated. So now I would like to welcome to the podium, I think she's behind me, Chief Judge Tanya Pratt of the U.S. District Court for the Southern District of Indiana. Judge Pratt.
Thank you, Dr. Kane. Thank you, Dr. Kane. Good morning, everyone. I just want, on behalf of the judges of the United States District Court for the Southern District of Indiana, I want to thank the Marion County Public Health Department for this partnership today in allowing us to bring this program and this wonderful mobile unit downtown to downtown Indianapolis. One of our greatest concerns in the federal courthouse, as well as the Minton K-Part Federal Building, is that we want our visitors, our staff, the litigants that appear before us to have access to the vaccination so that those who are able to get the vaccination can easily get a vaccination. The Birchby Federal Courthouse is open to the public. We firmly believe that justice is best dispensed when justice is done in person for the most part. We're still doing some video proceedings, but the attorneys and the litigants frequently want their proceedings to be in person, and we're here to serve. So we're just really happy for this opportunity, and we encourage all of our federal employees as well as all of the visitors to the federal buildings and to the downtown area in general to visit this mobile unit and get their vaccinations. Thank you.
Next, I would like to welcome Deputy Mayor Judy Thomas with the City of Indianapolis, Deputy Mayor of Neighborhood Engagement.
Thank you so much, Dr. Kane. And on behalf of the City of Indianapolis, we're really excited to be here and to partner and get all of our residents vaccinated. What a difference a year makes. It has been wonderful to see our city come alive, enjoying festivals, outdoor activities, restaurants, arts and culture events, and yes, even coming back downtown and coming back to work all over the city, interacting with coworkers and clients. We are moving forward, and the goal is to never go backwards. As a city, it is important to have the majority of our residents vaccinated to get the virus spread down. So do not hesitate. Protect your families, your friends, and your coworkers. The City of Indianapolis will continue to partner with the health department to get the word out of how important it is to be vaccinated. This event is free, no appointment necessary, and you can do it during your lunch hour. Very, very convenient. Yesterday we were on the south side of the circle. Today it's on the north side of the circle. So please, please stay connected to the city via social media, as well as the Marion County Health Department for more information on sites, mobile sites. It's so important that we all get vaccinated. Thank you so much.
And so here to share some remarks today is Judge Amy Jones, presiding judge for the Marion Superior Court in Indianapolis.
Thank you, Dr. Kane. Thank you all for coming out today for this very important event. As a member of our local judiciary, we have been really working hard for the past year and a half to continue keeping things moving in our city. And a big part of that is making sure that the health and safety of those that come before us and in the city-county building, that those people are safe. And I think the vaccination efforts, mobile clinics like this where you don't have to make an appointment, you can just walk in on your lunch hour, get the vaccination, and get back to work. There are so many folks returning to work over the last several weeks. We're seeing an influx of people coming into downtown. Our city-county building is home to many city and county offices, not just the courts. And on pre-COVID times, we may have had as many as 5,000 people walk through our doors in a single day. That's an awful lot of people, and this gives an opportunity for those who are in the downtown area, whether they are employed here, whether they're downtown doing business or something else, or just visiting for the day. We really encourage you to come out, take this opportunity, take advantage of this, and to be safe and well as we move forward here into the future. Again, thank you all for coming, and I appreciate Dr. Kane including the courts in this initiative, and we are happy to assist in any way. Thank you.
So it's going to take partnerships like this one with our federal and local courts, the City of Indianapolis, and Indianapolis Downtown, Inc., to share the message about the importance of getting vaccinated. Now, we look forward to giving this COVID-19 vaccine at this mobile unit today until 3 p.m., and we will be here next Wednesday and Thursday, July the 21st and the 22nd, from 11 to 3 p.m. at the U.S. Federal Courthouse, located at 46 East Ohio Street, just a short distance from here. So I want to thank everyone. Appreciate you being here, and we appreciate getting this message out to our community. So I'll stop, and we can take any questions directed to any of our panel members or anything.
Dr. Kane, how concerned should people be about the Delta variant?
So I think people should be very concerned about the Delta variant. It's now become the variant strain in the United States at 75%. That meant it was very contagious and moved very rapidly in a very short period of couple of months to become the dominant strain. Right now, in the state of Indiana, our Delta strain is at about 5% for the state of Indiana, but it can move up very rapidly. Number two, there's concern that the symptoms and complications related to the Delta variant may be greater than what we saw with our original COVID-19 strain.
When you said 5%, is that 5% of the COVID cases or 5% of the population?
So no, 5% of the COVID cases.
So it's not our dominant.
So no, so right now the United Kingdom is our dominant strain here. And of the strains cases that we're seeing here, this is based on just the surveillance data, 63% of our strains now are of some variant mutated virus. Based on, but the United Kingdom appears to be the most dominant strain with the Delta variant of those cases at 5% currently.
I realize some of the answer to this is, well, just wait a couple of weeks. But why is it that it has not got to the same result here as it has elsewhere? States are basically everything.
I'm going to have you talk just a little bit louder, sorry.
Yeah, I'm sorry. In some states, Delta is virtually 100% at this point. In Indiana, it's still 5%. Realizing that that can change very quickly, why has it been slower to take hold here than elsewhere?
I think it's been slower to take place here because I think we've had more restrictions in place compared to some of the other states. I know, like Mississippi, they're being very heavy hit. So I think a lot of took a lot longer to lift our restrictions compared to most people. So I think that's really key. But it also makes a difference, I have to tell you this, is the vaccination rates too. So we're sort of in that middle group in terms of vaccinations, for our communities. So the more we can get vaccinated, the less our risk for super spread coming from this Delta variant.
On that note, at this point that the vaccine's been broadly available for a couple of months, older folks like me longer than that, why is this diminishing returns at this point? Are there that many people out there who are interested but just haven't done it yet?
I think it's a combination. I think we're now hitting our folks who are the most hesitant, the most concerned about the vaccine. So I would say that that's the majority of the people who are not vaccinated. But it's just like everything else, parents can be late giving their vaccinations for their children and school started. So, people just sometimes put things off. They feel they have more pressing issues, and they may have more pressing issues depending on, I may have to worry about being evacuated from my apartment, what's happening with my unemployment benefits. So some of those stresses can make a difference. But also I think we have to have a better job of going to the people in their communities, in their social networks, instead of always asking people to come to us. Because it can be difficult. I may have to do bus transportation to a site, but if it takes me an hour to get there, vaccinated, another hour to come back, that's a lot of time out of someone's life, especially if they're concerned about not leaving their job. Can I take off from my job to get vaccinated? How accommodating are our employers to allow people to get vaccinated? So there are a whole host of issues, I believe, related to this. I think the gentleman behind you.
Can you talk just a little bit more about this unit? When did you launch it? What kind of volume are you seeing so far? I've just been here for a day and a half, and I haven't seen a whole lot of people going in and out.
So what I will tell you, we vaccinated 25 people yesterday. We saw an additional 80 people that we had a discussion about the vaccine and answering and addressing their questions. So that's a total of 25 and 80. How many is that?
105.
Just 105, yes. And that was from 11 to 3 p.m. yesterday.
And when did you launch this effort?
We launched this effort this week.
Dr. Kane, how will you measure success? Obviously, you are going to launch other vehicles. You're going to rotate this around the downtown area. And obviously, you want everyone to get vaccinated. That's not going to happen, as you know. But what will be success to you?
I think if we can reach at least 50 people a day from a vaccination, I'll be extremely happy.
I'm curious about those 80 people who came by with questions. What kinds of questions and how many, if any, said, okay, put a needle in my arm?
So, it's a whole host of questions, I think, concerned about, what are the long-term side effects related to this vaccine? Can you guarantee I won't have long-term side effects related to this? Just how really effective is this vaccine? Is it going to do what you say it's going to do? Some people, whether we like it or not, have a fear of needles. And so that's a major concern. They want to know how many people have already been vaccinated. And so it ranges all over the place. But our biggest group now who's not vaccinated are especially our 25 to 44 years of age. That's a younger group. We have a lower rate of vaccination, and if you break it down by racial and ethnic background, 18% of our African Americans between 25 and 44 are unvaccinated. So we do have trust issues related to receiving a new product that's out there. Some concern that it was rushed in terms of, is it really, really safe because it's under emergency authorization? When will it be fully authorized? And then we just have an invincible group. The younger they are, they never get sick. They don't feel the need to get a vaccine. They don't see the doctor. And they think, I don't know what you want to say, their hunks are superheroes. They just, from an immune system, they just think they're invisible. Invincible, I guess that's the word I want to say. Yes?
So the surrounding counties have much higher percentage rates of vaccination.
Sure they do. When you look at Marion County, month of May, we vaccinated 125,000 people. 75,000 were only Marion County residents. So where do you think those other, from 75 minus 125,000 residents were coming from that were not Marion County? Who also works in Marion County that may not live here? So we do a heck of a lot of vaccinations, but they don't always live in Marion County.
Dr. Kane, in a matter of days, a matter of weeks, parents will start packing lunches and sending little Johnny and Johnette to school. What will be your advice to the school districts as they anticipate that they're waiting to get guidance from you as to vaccination of those young people?
So we're really trying to encourage them to get vaccinated. We've set up some recent sites this month on Saturdays for 12 to 50-year-olds to get vaccinated. Really trying to encourage it. We've tried to be in 3 geographic areas for this vaccination. We will probably continue vaccination even when school year related to that, along with our regular children's immunizations that are required for people to be in school.
When you talk about when you talk about hesitancy, are you seeing?
When I talk about
hesitancy,
yes, hesitancy,
are
yes.
you seeing more of that in that 12 to 15-year-old group, or really it's the parents that you're talking to, not them? Is there more?
So I think it's a different reason for the older parent. The older parents, they think about clinical trials and like Tuskegee. The younger group, quite honest, it's just about them. How many of our, for example, our young males actually go in and get medical? So as compared to the females, and if they're not used to going and getting medical care, they have less access, I think, for a lot of medical messages in terms of how we outreach out to them. Any questions for our judges, guys?
Just to clarify, are the federal courts meeting partly in person, or are you still entirely virtual?
The entire time.
Well, there's one thing I think I'm going to have Deputy Mayor Thomas talk about, our initiative to try to address vaccine hesitancy.
Yes, not too long ago, there was a grant, $1 million grant, given out to community organizations, grassroots from throughout the city of Indianapolis, very focused on getting some of those folks, residents, and populations that have not been getting vaccinated at a higher rate. So we're starting to kind of measure the success of that as well with some of our community partners. So that's been very effective and was exciting to be a part of. Any questions on that? It was churches.